Namaste to you. I would like to share my experiences regarding backache. When it comes to backache, it's such a rampant clinical condition and notoriously relevant today from the age of 20s even till the age of 70s. Back can be considered in the most important way in terms of the neck and the lower back. Rather, the cervical, which has about 7 vertebrae, and the lumbar sacral, which is 5 each. The typical aspect is that most of the injuries are happening to the cervical or the neck area and to lumbar, which is the lower back area. And that's the simple anatomical reality. And that is why these injuries on the long run contribute to degeneration, and the lumbar area has more of the degenerative tendency. The good news is that Ayurveda has the best impact for these conditions. These 31 vertebrae that are relevant to the entire whole spine segment are very important for our health because they sustain our posture. The sad part is, in spite of the best efforts by the modern medicine, in the utmost respect towards the modern medicine, I would say that we still find it very common that the results are not very sustaining and not very satisfactory from the modern medicine perspective. Perhaps that is why we find plenty of people being on over-the-counter medications for relieving their symptoms, more importantly pain. Further making it complicated is the fact that in spite of surgery, many people with lower back issues, even upper back issues, they do have symptoms which are recurring. And this recurrence is definitely making life miserable to them. This is exactly where Ayurveda has a big role. How exactly? We will figure it out. To have a successful impact of therapies or medicines used in Ayurveda, it is very important to know what exactly is the reason of the backache. We would call it the diagnosis to be precise, or the etiology to be precise. The doctors of Ayurveda who study the textbook of medicine very clearly understand that there are 12 medical and 12 surgical reasons for lower backache. However, we would sometimes trace it to even ergonomic reasons. The science of Ayurveda has a huge set of reasons to attribute for lower backache issues and also for upper backache, and that leads right from the practice of having head oil that is not compatible to your head to even factors which are inflammatory in nature. So this brings to us point that whenever there is a reporting of a lower backache or anything that is of the spinal origin, we would always consider it, is it the reason from the back per se, or is it not a back area? There are situations of abdominal conditions that may show us lower backache issues. So to make it very easy, what we generally guide our patients is that there are 3 broad classifications as per Ayurveda. One is which is called inflammatory, and the details of that is very easy. Most people would say that they have a stiff morning. They get up in the morning with a pain that is something that lasts for a while, and that pain would be always there from getting up from a resting position. We would call it rest pain, or waking up position, or from a sleep. That always eases off with certain kind of activity by heat, and that is why it is called kind of inflammatory, and this is the best thing to treat and the easiest to respond. The cure prospects of this is very high, and this is the big majority of the reason of people reporting with lower backache. The second thing is degenerative, most commonly found in the lumbar, that is the lower back area. Degenerative is easily known by 3 simple things. One, it is more when you make some kind of activity. It is more when there is sort of cold exposure, and it is always relieving when you take rest. The science of Ayurveda has variable cure prospects for these conditions. The inflammatory one is the most easily cured. The degenerative one is the one that takes more time to cure, but it's usually cured. I would use the word usually because if it's somebody in the elderly 60s and 70s, it may not be cured. However, it would be definitely making sure that the Ayurvedic therapies give a good quality of life. The third one is something where the pain is all the time, constantly. we would mostly attribute it to something related to bone marrow level, wherein we would more implicate it to a reason which is more towards cancer, the oncology segment. Such painful situations are throughout, is always there. You do whatever, no matter what, it's not going to respond. And that is very difficult to cure and nearly impossible to cure. So this is how anyone with backache should be able to relate to which condition he or she is facing, so that they can very confidently think about the roadmap of recovery, which is of course the responsibility of doctors who are treating them. Now it is very important to realize which patient should be treated by whom. The fact of the matter is, it's a very confusing domain. The patient doesn't know where to go, whom to seek the best opinion that is beneficial in the long term and the short term also. So this brings us to the point of the importance of precise diagnosis. Many a times it is clinical, based on your symptoms and your history and the examination done by a doctor, a thorough diagnosis can be achieved. But many a times we need to rely on X-ray, CT scan, MRI, and worst case even PET scan, the costly PET scan that can go more than 20,000 rupees plus cost. The reason why people attribute a lot of carefulness in this is that many times lower back issues are becoming complicated due to iatrogenic reasons, which means a medical care makes it worse. There are very easy methods to realize whom should be treated by whom, or who should be treated by whom. So starting from a very common idea of having a precise diagnosis in the form of what we would call posture adjustment. If you make a driving of car with a wrong adjustment of your seat regularly as a habit, obviously you will have muscle strain and that can lead to lower backache. Obviously, if you are using a different sort of pillow, different sort of chair, your ergonomics, those kind of modifiable changes which are very much implicating the lower backache would always make the suffering perennial, constant. For this reason, we need to know if this is to be in the segment of modifiable reasons of low backache or non-modifiable, or should we know if this is to be treated by a physician or should be treated by a surgeon or is to be treated by a cancer specialist. And I will make this easy for you. Most of the conditions are treatable by a physician, be it Ayurvedic or any other system of medicine. However, there are certain red flags, and these red flags need to be very clearly known by everyone. Otherwise, it would be very dangerous and counterproductive if the treatment is done by Ayurveda only. If a patient complains of sudden giving away, we have to be very alert about just giving away, unable to walk, just getting weaker. It can be a situation of a muscle strain, can be a disc prolapse, it can be a matter of a tear in the ligament. So many possibilities are there. We always need to be careful about that. The ligament sprain is a very easy entity these days and times, with a lot of sports activities going on with many youngsters. Equally dangerous is the fact that if a patient has bowel incontinence, where the stools go off automatically, or urine incontinence, where a person is unable to hold on to the urine, control is lost automatically, involuntary. And if the person has foot drop, that is so easily seen. And a very specific term we call saddle anesthesia. In saddle anesthesia, you have a feeling of numb in an area in your back area that resembles like a saddle on a horse top. These are absolutely dangerous areas for Ayurvedic physicians to deal with. It is best left to a surgeon. A decompression surgery or other kind of surgical interventions would make life easier and safe. That is where you better go to a surgeon and not to an Ayurvedic physician dealing in a medical way. However, there are many conditions in lower backache, in many conditions of cancer, which is basically caused by a primary in the lungs or prostate or other parts of the body. A cancer causing low backache can be easily understood, sometimes by an X-ray, yes, to an extent, sometimes by CT scan, maybe MRI scan, and even sometimes PET scan. So that is something that is to be treated only by an oncologist, because the reason is cancer. So these comprehensive details help us to understand who should treat and what, and this helps you to prevent any kind of further damage to your health. Very importantly enough, there is a common practice of going to chiropractors and what we may call as muscle manipulators or jerky practitioners, as we call it, with jerky movements such done, which help in majority of the case, but sometimes it would be catastrophic if an elderly person already osteoporotic has a compression fracture and then somebody is doing hard manipulations. So this is the comprehensive way of understanding the red flags and how we can prevent any kind of tragedy. Even if there is no good happening, we don't want bad happening to anyone. Now let us talk about the solutions. Solutions are very important. We have discussed about the anatomy and the reality. We discussed about the causes and how do we differentiate the causes, how you can relate to which backache you have. We have come up with the options of the specialist who can handle your situation better. Now let's talk about the solutions. The science of Ayurveda has a very comprehensive idea about it. So what we do at Athreya, and I'm sure most of the Ayurveda centers may be doing it, is that we try to know the root cause of the disease much before a patient comes to us. It's done through a teleconsultation, wherein a detailed medical form is received of your health complaints. It's meticulously and thoroughly studied, analyzed, and conveyed to you back what could be the most likely diagnosis and what is a roadmap of recovery, short term and long term. Most of the lower back aches have a tendency to a recurrence. So we strive to work on that, not to recur and not just to make the cure only. So this brings me to the point that when we have a clear understanding of the problem, we mostly employ it in two manners. One is OPD. There are many patients who do get benefit even without coming to us through the teleconsultation, because that fairly gives us a fair understanding of what is exactly the problem faced by the person. And that is done by a clear understanding of their food, their lifestyle and their symptoms. And medicines are dispatched accordingly. It's not the most ideal way, but it is still doable in today's day of corona time, limitations of travel, etc. However, a real time and a deep level of involvement usually happens by the IPD level, inpatient department, where somebody goes through meticulous therapies. We may call it external application based therapies. We would call it internal application based therapies. Panchakarma is done in various manners. Procedures which are purifactory and detoxifying in nature are done. Procedures which are anti-degenerative are done. And what precisely makes the healing faster and better is that the human body has a fantastic ability and urge to heal itself given the right kind of conditions, and we provide those kind of right kind of food pattern, right kind of lifestyle, and the aspects which are more related to muscle strength, nerve rejuvenation. And how we do that is very clearly explained through our videos. Even much before somebody decides to come to Athreya, we make sure that those videos of therapies and protocols are shared, discussed, so that you are very well aware of what you are getting into. And that makes the roadmap of recovery faster and more transparent. This brings me to two important itineraries of healing in this musculoskeletal disorders. Many of the lower back issues or lesions, as we call, of the vertebral column, as we all know, it's 33 vertebrae. It's not 31. It was a slip of tongue from my side. So the fact of the matter is that whenever a disease is not getting sufficiently cured, or whenever there is a recurrence, we always have to ensure the fact that the root cause is removed through the purifactory regime. However, Panchakarma alone is not enough. We have had many occasions where we had to rely successfully the parasurgical aspects of Ayurveda, and that involves processes which may look scary, but they are very safe and very effective and very endurable. We call it Raktamoksha, which can be called as Siraveda. Raktamoksha is bloodletting. It may be like a phlebotomy from the leg area or the hand area, depending upon the requirement and the indication. It would be forms of what you call as wet cupping. We would use procedures which are, we say, thermal cautery. We call it Agni Karma. And there are many varieties that we implement into it. All these usually help the disease not only to be cured faster, but also in a deep manner and without recurrence. And the last thing I would attribute, something that is not very much practiced in most of the Ayurvedic hospitals, regretfully enough, that's my study and understanding on it, is Snehapan. The biggest advantage in Ayurveda is the non-recurrence of these degenerative disc diseases, which is internal usage, internal drinking, consumption of either herbal ghee or herbal oil and those kind of unctuous natured medications, which really help us to prevent recurrence of a lower backache patient. So these techniques are very much followed in Athreya for a very long time, and we really hope that these techniques are followed in other Ayurvedic centers so that the suffering patients of backache of whatever reasons, and that which is easily curable without recurrence, and those practices we hope that are practiced in other places also for the welfare of everyone in our society. Thank you.